Across the country, public health nurses walked out of their respective workplaces in protest against poor working conditions and salary deductions. The walkouts began on Saturday at around 4 p.m. with nurses at the Southern Regional Hospital.
It hurts us every day to have to come to a place knowing that the reason why we come is because we care for our patients. We really care for our patients. The hurt that we go through is deep.
This morning, nurses across the country, from the Corozal Community Hospital, the Northern Regional Hospital, the San Ignacio Community Hospital, and the Western Regional Hospital, staged similar protests.
We're all from the study leave program, the University of Belize midwifery program. We are here to support the nurses countrywide. We are here to stand with them and show our solidarity, show the country of Belize that we are not standing out here for a finance purpose, but we are standing out here for the service that we are out here to give. We are expected to give us services with low resources. People post on Facebook the service that they get. When they don't receive the service, they state that they received a bad service. But do they know what it is like for the nurses and doctors to come up with the resources, to fight for resources, to request for resources, to beg for resources? It is not easy.
Every month, our overtime is being cut. We are being told that we are owing hours. Nurses can't understand how we are owing hours when almost every week we're working 48 hours per week. And our regular hours is 40 hours. So if we're working 48 hours times 4 weeks, how could we be owing hours? And whenever the overtime comes in, it is always short. We are not being paid in full what we are being worked for, what we are working for, and we're tired of this. We're tired, right?
And how long would you say you guys have been working under those type of conditions?
For quite a long time. Not recently. This has been going on for quite a long time.
The president of the Public Service Union of Belize, Dean Flowers, was also at this morning's protest in front of the Western Regional Hospital.
What's hypocritical is that we were singing praises for them 2 years ago. We were applauding them. And in the same breath, we have continued to hold them hostage under the kind of inhumane and unsanitary and not the best working conditions. Some idiot from the Ministry of Finance passed a rule that nurses must give account of every single hour that they work. It's unfair for them to have to give account for every single hour, but the masses of public officers does not have to do so. They did not create their schedule. So the fact that you only have them working 36 hours for a specific week is not their fault. So you cannot turn around and penalize them and deduct from their substantive salary 4 hours. What about the average public officer who comes to work 9 and 10 o'clock? And you can go to all those ministries and look at them. And they still get their full pay.
You have people that came to a paycheck this end of month with $200. Attendance and PCAs that only received $200. How sad is that? We're already paying 25% tax. We're already paying 10% Social Security because they increased it. For what? So that they can give money to someone that probably doesn't even need instead of investing it in the health system.
Nurse Dorita Pineda, who is employed at the San Ignacio Community Hospital, noted that her colleagues were not protesting against the government. They were only demanding that those in power fulfill the promises made to make the necessary changes.
This is not a protest against the government. This is a protest for the government to come and stand with us and show us their support and show us what they promised. We asked for a change. And they're there because the people voted for that change. And we're just asking them.
Reporting for News 5, I am Paul Lopez.